Hello, my name is Manuel Barragan, and today I'm presenting this video in hopes to inform you about my observations of our practices when delivering effective post-surgical instructions to patients and their parents or caregivers to best prevent infections related to surgeries. Also, I will be informing about cultural competence and its importance in healthcare settings in hopes that this will better equip you in ensuring proper post-surgical instructions to patients and their parents or caregivers. Let's begin. Here at Shriners, we aim to provide superlative service to all patients in a manner that ensures positive outcomes with each and every patient. In the span of 3 months, and with much of the assistance of personnel, I was able to follow surgical cases during the post-surgical period, beginning at discharge from our facility. During that time, I was able to follow a total of 112 surgical cases. This included tracking their progress up until their first post-operative visit. Of those 112 surgical cases, a total of 0 infections were reported. Much of this is due to the adequate instructions delivered before the patient is discharged. This includes both verbal and written instructions provided to the patient and their parents or caregivers. While many of the instructions are standard, and for the most part are adequate, they can vary depending on the individual patient's needs. I observed these modifications in real time, and each time they were done in most friendly manner by the staff member. While, as I mentioned, they are very adequate, there is still some room for improvement. But we must also remember the growing and diverse populations we're treating here at Shriners Children's. We have families from diverse ethnic, racial, religious, and socioeconomic backgrounds. This is where cultural competence comes in. Cultural competence is defined as the ability to interact effectively with people of diverse backgrounds and different identity groups by being sensitive, appreciative, respectful, and responsive to beliefs, practices, and cultural needs that are different than your own. According to Tulane University, in healthcare, cultural competence improves communication, which keeps patients safer. Georgetown University adds that if cultural competency is applied effectively, it can help improve health outcomes and quality of care. Just as the Chicago School of Professional Psychology adds, cultural competency can help you as a nurse because it helps you offer the best service to every patient, leading to high satisfaction and care on the side of the patient. You can do this with the information already provided to you on the patient's profile sheet, which will tell you the patient's religious or preferred language. As mentioned, here at Shriners, we aim to provide the best service and care to every patient. Therefore, becoming an expert in cultural competency will help each and every one of you modify your post-surgical instructions depending on the individual needs and background of each patient to ensure they leave our facility well-informed and continue our streak of mitigating infection rates. So let's follow some steps. First, you have to acknowledge cultural differences. Understand your own culture. Engage in self-assessment and evaluate. So by following some of these cases here, you will better understand or evaluate a patient's needs. And by understanding the patient's needs, you can modify your approach in delivering those instructions. So let's always remember, before a patient leaves our facility, let's make sure that proper instructions are delivered each and every time. Figure out how to deliver those instructions, and you will ensure they do great each and every time. Again, my name's been Emmanuel Barragan. Thank you for your time.